Good afternoon, George Neal. Let's begin the warm-up session. What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET-speaking roleplay.
Good afternoon, I'm Nurse George Neal, and I'm here to assist you. May I know your name please?
My name is Mihiraa.
Hello Mihiraa, thank you for coming in today. I'm here to understand more about what you're experiencing and see what we can do to help manage it. Could you share with me a bit about what brings you here today? Well, I've been dealing with hair fall lately, and it's been worrying me. I'm not sure why it's happening, but I feel like I'm losing more hair than usual. I understand Mihiraa. Hair fall can be quite distressing, especially when you're unsure of the cause. Could you tell me more about your hair fall?
It started around 3 months ago. At first, it wasn't too bad, but recently, I've been losing more hair each day. I haven't noticed any dandruff or anything unusual on my scalp.
Thank you for sharing that detail Mihiraa. It sounds like it's been getting more noticeable, which would naturally feel concerning. Sometimes, changes in our routines or health can affect hair fall. Have you had any recent lifestyle changes?
No, I haven't been under any stress recently, and I'm not taking any medications. I'm not really sure if there's anything else that could be affecting it.
I see. Well, thank you for letting me know. Let's consider your daily hair care routine, as that can sometimes play a role as well. Could you share the details of your daily hair care routine?
I actually wash my hair every day, and I do use some styling products pretty regularly. I hadn't thought about that being an issue, though.
That's very helpful to know Mihiraa. I can understand how distressing this must feel. Hair fall can happen for several reasons, many of which are more common than people realize. For instance, genetics can play a big role. Sometimes hair loss patterns run in families. Hormonal changes, which happen naturally throughout life, can also affect hair strength and growth. Stress is another factor that can contribute, though I know you mentioned you're not experiencing that right now. Nutritional deficiencies, even ones we may not notice immediately, can impact hair health too. Our hair depends on nutrients like iron, vitamins, and protein, and a lack of these can lead to hair fall. Additionally, environmental factors, such as pollution or changes in weather, might also have an effect. The important thing to remember is that hair fall is very common and, in most cases, manageable. With the right care and possibly a few adjustments, many people see noticeable improvement. So please know that you're not alone, and we have options to help get things back on track.
All right, that's reassuring to know. What can I do to start improving things now?
Mihiraa, I can see how much this is weighing on you, and I'd like to share a few gentle tips that might help reduce hair fall and keep your hair as healthy as possible. First, using a mild shampoo is a great start. It cleans the hair without stripping away essential oils that protect it. When it comes to hairstyles, try to avoid tight ones like buns or ponytails, as they can pull on the hair and cause it to weaken over time. Heat styling tools, like straighteners or curlers, can also be rough on the hair, so limiting their use when possible could make a big difference. Brushing gently is another small step that really adds up, as overbrushing can stress the hair and cause breakage. A good approach is to let your hair air dry whenever you can, and use a wide-tooth comb to detangle. This puts much less strain on each strand. These are small changes, but many people find them helpful over time. Let's work together to keep your hair feeling healthy, little by little.
All right, that makes sense. Is there anything else I should be mindful of?
Absolutely. A nutritious diet plays a big part in supporting hair health. Foods rich in vitamins and minerals, such as leafy greens, nuts, eggs, and fish, can help maintain healthy hair growth. If you have specific dietary needs or if you're uncertain about any areas of your nutrition, it might be helpful to consult a dietitian. They can offer personalized guidance to make sure you're getting everything you need to support your hair and overall health. Taking small, balanced steps like this can be empowering, and consulting with a dietitian might be a great option for tailored advice.
That sounds good. But if the hair fall continues, what should I do?
Mihiraa, if you find that the hair fall continues or if you notice any new changes, there are definitely more steps we can take together to address it. In cases where hair fall is persistent, consulting with a doctor could help us identify any underlying factors that may be contributing, like hormonal imbalances or other health concerns. There are also various treatments available, such as topical applications, which can support hair growth and strengthen the hair from the roots. If you'd like, we could arrange a follow-up appointment to review your progress. This way, we can stay ahead of any new symptoms and make adjustments to the care plan if needed. Please remember, we're here to support you through each step, and together, we can find the best approach to help manage this.
Thank you, I appreciate that.